Today we're talking about benzo abuse. People know these drugs commonly, household names like Xanax.
Right. Valium, Xanax, Ativan, Klonopin, Librium. Benzodiazepines generally have an immediate effect that's short, that only lasts a little while, a few hours to, up to several hours. There's no doubt that they work and they relieve anxiety. They're meant to be used for short periods of time to get a person past a really difficult few days or maybe up to a week. And that's all they were intended to be. The purpose for using the medicine to reduce anxiety, it turns out that they don't work chronically. They won't benefit the patient. They actually cause an increase in anxiety, and it can cause all sorts of things long term.
One bit of research that I just thought was astounding was that some folks who are misusing these benzos, they are more at risk of getting Alzheimer's. They are that degenerative to the brain.
We're definitely seeing cognitive decline, and it's directly correlated to the length and amount of benzodiazepine use. And so young people who have used a medicine like Klonopin or Valium for 10, 20 years are having Alzheimer's-like symptoms, and they don't always get better when the patient stops using the sedative medication.
This is more difficult to get off of than heroin. That is how your body becomes so used to having it in you.
Yeah. In some ways, heroin addiction is more immediate, and the withdrawal is very painful and dramatic. But in the long term, it's much easier to quit a drug like heroin or another opiate than it is to quit a sedative, especially if you've used that sedative for a year or more. The chronic use of a strong sedative like Xanax changes brain chemistry somewhat semi-permanently. And it takes a long time for the brain to recover and reset itself. As time goes by and you repeatedly, daily use a drug that really takes a hammer to your alertness, to your mood, to your ability to regulate your own sleep and wake cycles, you become more and more dependent. Your life more and more revolves around using that pill every day. You find yourself completely dysfunctional without it. And then if you wake up to the reality that it's hurting you and you decide you want to stop, you find that it's very, very difficult. It takes a long time, and every day spent trying to reduce that dose of the benzodiazepine is a difficult day. It's an anxious day. It's a day where sleep is hard to come by, even with help. And so it's especially troubling.
This isn't making headlines nearly as often as opioids.
Because benzodiazepines have sort of flown under the radar for a long time, a lot of people have maintained use for many, many years and not understood the danger that they were in. And so there's quite a few people out there who, when they decide to come in and get some help, they can succeed, and we certainly are eager to help, but it's not easy. And it's frustrating because here this medicine that was supposed to help them has turned out to hurt them. The public's expectations for how a doctor practices, it has a really powerful effect on how doctors work, on what they do. And when your patients who seem to be doing okay, if you don't know how to look for the right signs, come to the office and insist on and expect a continuation of a little bit of Klonopin or Valium every day, it's tough for a doctor who hasn't really grappled with the issue to say no, or to have a longer talk and try to steer that patient away from that potentially damaging habit. And so that's really where the change has to happen, is in our understanding the dangers of habit-forming drugs like the benzos, and the reality of the disease of addiction, and then the way we think about how disease should be, or how the disease should be treated.
How can a family member or loved one maybe approach someone who they believe might be abusing benzos?
Approach that person, that situation, with compassion, and understand that the person who's misusing his or her medicine is struggling with a painful and difficult problem and should be looked at as someone who needs help rather than someone who needs condemnation. Acknowledging that an anxiety disorder is no fun and it's very real. Anxiety, sleep disorder, panic disorder, all of those things can be treated. They can be treated in a healthy way with medications that don't have the dangerous side effects that benzodiazepines have. To remember that there's hope, that people can get better.
Fantastic, thank you.
Welcome.
Dr. Thompson says about 20% of drug abuse is to benzos, and it's important to note that benzos, when mixed with other drugs or alcohol, can be deadly. For more information on stories featured in today's show, visit vpm.org/Virginia Currents, then click on Featured on Currents.